what extra courses that you do to help on your practice and why have you chosen them? And relating to the previous question, so how did you know what the community needed? And like, do you think it's valid? Like it's good to just try to look at the courses that people need in your area to offer them what they need?
I think to be an active listener with your patients, direct access or not, because they have access to so much information now through the internet, through articles that they read. And a lot of times it's patient driven. They'll say, hey, I read an article about fill in the blank. What do you think about that? And so just to listen. And if you hear enough of that going around, you need to step up your game and you need to like educate yourself to provide them what they need. So I think that, and the courses, as far as what specific courses, like let's just say people mentioned dry needling, which dry needling did I choose? I feel incredibly fortunate at STAR. They have an unbelievable continuing education program. They offer multiple courses for us throughout the year. And so if you have an interest coming up, you just need to look and see what's available. The McKenzie courses, like you briefly touched on that. I wish I'd taken those earlier in my career. I didn't start taking those until maybe 5 years ago. And now I'm McKenzie certified, maybe longer than that, 5 or 6 years ago. But I feel like it's huge in developing just your thought process and a good rationale to base evaluation and treatment decisions on. And so it's a really good way to organize thought. And I know you're McKenzie certified, so do you feel that way too?
Yeah, it made a huge difference on my practice, the way you think, the way you assess, and like self-treatment prevention. I think it's a really good asset to have.
I think so too. And talking about empowering the patient, that's huge.
Yeah. And especially now, right? Like on this telehealth and everything.
Yes.
And it helps a lot. All this education process and all the movements that we can test that we don't have to have the hands-on. So it helps a lot in this situation as well.
And they feel very much that they're in control.
Yeah.
And I think that also fosters that sense of independence and not feeling like they have to have us. And especially, that's what you want anyway, but especially in a time where you have 10 visits for the calendar year, like you have to be efficient and effective.
Yeah. And how about dry needling that I know that you use? How does that work? Like, what do you think about the method, the technique?
I was very hesitant to start that. I think it was just my own nerves about that. It has been incredibly effective, I found, for headaches, like that chronic upper trap, that upper quarter pain. I've found like mixed results with back pain, but significant results with really pinpoint like shoulder pain and knee pain as well. It's acupuncture needles, and that's the only thing that's the same. We're going after trigger points, top muscle groups. It doesn't take very much clinic time. And I feel like that's what I was afraid of initially, because the thought process is to create a local micro trauma. It's not like acupuncture where you have to leave the needle in for a long time. If you're thinking about our rationale to create micro trauma, to increase blood flow, to help circulation, help the muscle relax, as soon as you put the needle in, your goal's met. So you can take it immediately back out. A lot of times patients are nervous because they hear needle. When you show them, it's like fishing line. And a lot of times if I talk about doing it, I will put one like on the unaffected extremity, on an unaffected part, and just so they can see it and feel it. And once the fear is removed, they're open to try it. I don't know if I told you this, Mariana, but like I'd had just tremendous hip pain for a while, and it was incredibly deep. And so deep, I was just convinced it was a labral tear or like something just intracapsular, because every time after I would sit or anything with like a lot of extended hip flexion for protracted time, when I would stand up, I could hardly bear weight. It was so painful. And at the dry needling course, that was the first thing we dry needled was the hips. And I had almost no pain the next day. And I thought,
wow.
Maybe there's something to this here. So I was convinced just after that.
Nice. That's very interesting. And did you have any remarkable outcome with the dry needling with your patients that you would like to share? Anything in particular that you remember?
I'm just thinking in particular of somebody, she was in a pretty significant car accident, and she'd also sustained a concussion. So she had some post-concussion symptoms, but suboccipital headaches were unrelenting for her. She worked in an office. She had to be on the computer, and her headaches would become so severe that she would have to leave work to go home. So once we started to do dry needling in the suboccipitals, just after the first time, she came back the next visit within the same week. So it was like 2 days different, in tears, because that was the first time she hadn't had a headache since the accident. Like there's that. And then there was somebody that we had seen him post-op knee surgery, and he is very active, avid traveler, and he couldn't mountain bike because of his quad pain. So once we started dry needling his quad, he sent me a video from the Alps where he was riding his mountain bike in the Alps. And he said like he couldn't have done that before dry needling. So there are those cases they're pretty remarkable.
That's awesome. That's so rewarding to have this feedback with like you're really making a difference in someone's life. So I think that's very exciting.